Hi there, I am Steele Stevenson, and for my informational interview, I chose to interview a close friend of mine, Claudia Berman Solo, who is a respiratory therapist at the Veterans Association here in Boise. She began her respiratory career at Boise State University, graduated, and began working at St. Luke's before transferring to the VA. She currently also teaches clinicals here at Boise State. So I asked her what prompted her to go into this career path. And she shares that her dad has severe COPD, chronic obstructive pulmonary disease. And she shared that this is what introduced her to the career path, as she wanted to learn more about the physiology behind respiratory illnesses like her dad's. So a typical workday for her consists of delivering rescue and maintenance medications, giving lung hyperinflation therapy, bronchial hygiene treatments, and managing patients on ventilators. She is also a part of the rapid response teams that keep the airways clear during code blues. And a typical schedule for her is about a 12-hour shift during the day, 6 a.m. to 6 p.m., or a 6 p.m. to 6 a.m. shift. Sometimes she'll have a shift that would go from, say, 6 to 2, but that's fairly rare. And then with her scheduling at Boise State, she typically works 2 clinical shifts twice a week, which are roughly 8 hours. And then I wanted to know if there was any growth in her career path, and she said that she can either move into outpatient positions such as home oxygen or pulmonary rehab. She could also work towards a supervisor position that would look over an entire RT department. She mentioned that there is paths that allow you to further your education to move around within a hospital. And in her case, what she did was become a clinical professor at a university. Then I wanted to know what she thought would be the most difficult part about this job, or what is the most difficult part about this job. And she shared that the most difficult part is probably the fact that it's inevitable to witness death. And in her case, it's very often, as majority of her patients are elders. She also shared that this was especially pushed to the limits during COVID, as it was extremely difficult to see the patients that were not allowed to see their families and had to go through these awful experiences by themselves. So some pros that she shared about working at the VA specifically is that she gets federal government benefits. It's also a relatively small hospital with close-knit employees, and the patient population that she works with is also very close-knit. She said it's very rewarding to serve veterans and get to know them throughout the years, as many people in her family are veterans as well. She also said that there are many VAs throughout the country, so there's opportunity to transfer to another facility if she wanted to move from Boise. She shared that a con could be the patient population, as it is typically elderly people, since you do experience a lot of death. And since the VA is strictly adults, so if somebody, say, is interested in caring for babies or going into pediatrics, the VA would not be a good option. And for anybody who is interested in becoming a respiratory therapist, she said the best place to start would be to visit the head of the BSU RT program. She shares that the staff at Boise State are very well versed with the community and would be very helpful in pointing an individual in the right direction. I then asked, what actions and choices would you recommend to someone going into your field or into the healthcare field in general? She said to ask around for someone who'd be willing to allow job shadowing. The best way to see what any given field consists of is to immerse yourself in it. Try to find a mentor that helps you find answers regarding your schedule, job responsibilities, benefits, growth, opportunities, etc. My last questions were really about COVID, as it was a respiratory illness. And she said COVID had a very strong impact, as it really impacted her job and the amount of work that she was having to do. The amount of critically ill respiratory patients dramatically increased in her position. And there was, especially towards the beginning, there was so much unknown about how to treat COVID, which made her job very stressful. And she also shared a little bit about healthcare worker burnout through COVID. But she also did share that with COVID allowed for other options in work as travel nurses or travel RTs that allowed for higher income and also the ability to have a change of scenery. Overall, from this experience, I feel that I would not want to go into respiratory care, as she showed a side of it that proved that it's a very difficult position to be in. But she also shares how rewarding it was.